Yeah, the government reluctant to introduce new measures here, Zara, even though they've admitted we're looking at several 100,000 infections a week in the near future.
Yes, Claire, so I think this is what we can take from this attitude, is that this is very much living with COVID, and we've heard about this for such a long time, haven't we? I mean, we know that there are thousands and thousands of cases now. Every person watching the news this lunchtime will know somebody who has COVID. In terms of disease severity, that's not the concern, but the knock-on impact and the high numbers is massive. You're talking 1,600 patients in hospital with COVID. Even if it's a secondary infection, they're being treated in isolation, so it's having a big push on. You're also seeing then frontline workers becoming infected. Just under 6,000 frontline staff members absent from the HSE now due to COVID. You're dealing with overcrowding across the board. So the emergency department, the ED task force meeting yesterday, they're saying, look, we're recommending the minister urgently convene the necessary public health resources and advisors to consider any measures that may be appropriate in order to provide an increased level of protection. But Stephen Donnelly saying that measures would have to be really extreme to bring this back under control at the moment. He was speaking this morning on the way into Cabinet.
The public health advice to me is really clear in not considering bringing in new measures, but re-emphasising to people, use the masks at the appropriate times. If you are symptomatic, stay home till 2 days after major symptoms have resolved. And critically, for that approximately 700,000 people who've had the first 2 vaccines but haven't yet taken the third dose or the booster, that it's really, really important that they do that as quickly as possible.
The ED task force warned yesterday that there is an unsustainable level of risk to patients at the moment because of this current surge of COVID-19. So it is an enormous issue, but it's worth noting that the legal backing in terms of any sort of emergency powers, that expires on Thursday evening. So the government's hands are somewhat tied in relation to that. The likes of the INMO had been calling for a temporary mask mandate, saying that would make a big difference over the next couple of weeks, but certainly the government not minded to do anything in relation to that in the immediate future.